It's always interesting in a meeting like this when you have a microphone. It really makes it serious when you talk. So we'll go ahead and get started. So thank you, everyone, and welcome to 2020, our first meeting of the Program Quality and Alignment Committee. Happy New Year, everyone. So my name is Melissa Colesman. I'm one of the co-chairs of our committee, and our other co-chair, Anna Jo, is here as well and feeling better, and so we're so grateful for that. So let's start the meeting by just doing a quick introduction round on the table. So let's start here.
Ida Rose, Catholic Charities of Pueblo, and also a member of the ECLC.
Good morning, Alex Murphy with the Colorado Department of Public Health and Environment, Children, Youth, and Families Branch.
Hi, Heather Craiglow, Historic Collaboration Office of Early Childhood. Patty Velasquez with the Family Resource Center Association.
Shannon Lincoln, the Wheelhouse Collaborative.
Akania Orlandella Ogren with Colorado AUIC.
Good morning, everyone. This is JC Montoya Price with the Colorado Children's Campaign and the Raise Colorado Coalition.
Hunter Raley, Small Business Majority.
Laura Knudsen with Parent Possible and the Colorado Home Visiting Coalition.
Lindsay Dorneman, Office of Early Childhood.
Nicole Reals, Executive Partnering to Invest in Children, otherwise known as EPIC.
Heather Turton with Parent Possible.
Lindsay Reeves, I'm the Director of Early Childhood Programs at Catholic Charities in Pueblo.
Tiffany Garcia, Catholic Charities in Pueblo.
Ben Gressley with Lakeshore Learning Materials.
Dr. Jose Silva, the Executive Director for the Colorado Association for Infant Mental Health.
Emily Bustos, sorry, I know my name. Denver's Early Childhood Council.
Joyce Johnson, Colorado State Library.
Good morning, Heather Hanna with the Early Childhood Council Leadership Alliance for Excellence.
Kristen Lang, Office of Early Childhood.
Chris Miller, Denver Preschool Program.
Amanda Pelletier with the Early Childhood Leadership Commission.
Therese Tay, Office of Early Childhood. Ms. Emmons, who's online? We have Morgan Yankee, Stacy Petty, Connie Fixon, Janice Pryor, Sherry Valdez, Amber Bilby, Lisa Jansen Thompson, Sandra Branham, Julie Pope, Amy Payton, Dawn Clough, Denise Fletcher, Heather Blanco, Jackie Florendo, Janet File, Kelly Bowes, Linda Meredith, Lucille Echohawk, Melissa Sherlin, Sherry Hannah Rue,
It's so wonderful to know that so many people are participating remotely as well, and I'm so glad that we've been able to find a place that will enable us to have the technology and the audio in order to do so effectively. So thank you, everyone, for using your microphone when you need to speak so that our folks who are participating online can hear you, and also especially for us soft-spoken folks in the room. If your microphone remains on, just make sure you do turn it off at some point so that we don't hear rustling. We can tell it's really sensitive, so that's great. Well, the first item on our agenda after our welcome is to review and approve the minutes from our December meeting. So these were sent prior to our meeting together, so I'm hoping that you each had an opportunity to take a look at those. And I will accept a motion to approve the minutes. I'll move. Second? Anybody want to second? Awesome, thank you. And all in favor? Any opposed? All righty. Well, thank you. Well, one of the primary items in the December meeting was information about the preschool development grant. And since that meeting, we have the announcement that Colorado did receive that, so congratulations. We know that a successful application like this takes the efforts of many, many, many people, and those who work closest to it put in countless hours. And although they give credit to everyone else, we acknowledge that the Office of Early Childhood did a tremendous lift on this, and we appreciate their efforts and congratulate them. So we have an opportunity to get an update on that, and so we'll turn it over to Lindsay.
Well, good morning, and it's exciting to see a number of new faces and hear a number of new names on the webinar today. It's just a fun way to kick off the new year. So as Melissa said, Colorado's work around the preschool development grant will be allowed to continue through December 2022. Looking at our timeline, the strategic plan was endorsed by the Early Childhood Leadership Commission on December 19th. So this document that was handed out and shared with folks online does capture the strategies that the ECLC is supporting for the work moving forward. Currently, the needs assessment report, full strategic plan report, and program evaluation are with our federal partners at the Administration for Children and Families for review. Following some new information from that team yesterday, we learned that those documents likely won't be accepted by our federal partners until the end of the month, based on some of their timelines. What does that mean for us? It really means that we don't have an opportunity to start on our renewal activities until they've completed that review and accepted those documents. So in the meantime, I'll be working with our project officers, which will come from both Health and Human Services as well as the Federal Department of Education, to determine if there are some activities we can begin in January or February, but realistically, we don't expect a lot of the grant work to begin until next month. Because we're waiting on that strategic plan, we're not widely distributing at this point. This really is the document we're pushing out, showing our best intent, what we plan to do. Once we get federal acceptance, we'll have broader distribution. The first opportunity to really start sharing that information out will come on February 5th with the co-presentation of the strategic plan with the ECLC's annual report. So hopefully you receive that invitation and plan to join us on that date. The Office of Early Childhood is also working with partners to schedule meetings across the state to roll out the strategic plan, as well as share key findings from the needs assessment. So those 12 findings that were shared last month are things that we definitely want our partners to be aware of and start contributing to and commenting on so that we can begin to address those. Currently, we're planning on looking at meetings across the state in February with target communities, including Grand Junction, Pueblo, Loveland, perhaps visiting both the Ute, Mountain Ute, and Southern Ute, as well as any other communities or meetings we're invited to. So if you have things in mind or if you have local gatherings, make sure you share those with the office, because we would love to plug in where we can to be able to do a wide distribution of the strategic plan. We did receive confirmation of our no-cost extension, so initial grant activities will continue through February 29th. We have about 30% of our activities that we're still wrapping up, so you'll start seeing some deliverables come out of our office. So thinking about some of the reports that we're generating, some of the tools that we've created, as well as thinking about some fun tools, like the Early Learning Development Guideline videos should be completed by the end of February. In terms of disseminating and distributing those, we will be posting those on the Colorado Shines Brighter webpage and sending out notifications to partners. And so really that is going to be where you want to go for information and to learn about some of the activities that are wrapping up in year one. So the renewal grant. Colorado originally requested almost $12.5 million. All states that were awarded took about a 11% reduction. So our final award is closer to $11.1 million, which results in about $33.5 million over the course of the 3-year period. Colorado is only one of 20 states out of 46 states who had an initial grant to receive a renewal. We're the only state in the Mountain West and the only state in our federal region currently to have an award. So we definitely will have eyes on us, and we'll continue to work with PQA to ensure our success. As a reminder, within this grant, states are required to use existing federal, state, and local and non-governmental resources to efficiently strengthen the delivery of existing programs. So again, it's really going back to one of those tenets of the initial grant of building on what exists, identifying what works, and continuing to expand or invest in those programs and services. Alignment and coordination across the delivery of services and funding streams continues to be a priority. So thinking about how we maximize the use of resources within the mixed delivery system. They also want us to continue to look at recommendations for better using existing resources to improve the overall participation of children in the mixed delivery system, especially thinking about vulnerable, underserved populations and populations living in rural areas. So again, as we look back to last month's presentation and some of the findings from the needs assessment, we clearly have defined some of those vulnerable and underserved populations across Colorado, which are now the target of the efforts within the Renewal grant. Again, they want us to look at improving program quality while maintaining access and availability of services. So we don't want that tension of improving quality and then reducing the amount or the availability of those services because we're moving our investments into quality. Again, maximizing parent and family choice. So ensuring that families have the ability and the access to select the programming that best fits the needs of not only the family, but the child. And so what does that menu of options look like for Colorado? And then finally, enhancing school readiness, especially for children from low-income and disadvantaged families, and supporting those transitions of those children into elementary school. So clearly Colorado hit those requirements, and we look forward to launching activities again in February to start working towards those objectives. So again, I just want to revisit that we are now operating under essentially 2 frameworks. So we have the statewide Birth to 5 strategic plan, as well as the PDG Renewal grant. So about 36 or so of the strategies that have been adopted within the statewide strategic plan are going to be funded through and operationalized through the preschool development grant. However, there's still about 21 strategies, I believe, that are not going to be completed within PDG due to resourcing or scope. And so we'll be working with the PQA to identify some champions for that work. So that's a great seg into the role of the PQA subcommittee moving forward. So I recently had a conversation with the co-chairs to discuss how we want to plug PQA in to this work moving forward. So the Program Quality and Alignment Subcommittee will continue to serve as the advisory body for the Preschool Development Grant. So we encourage people to continue to come here to not only learn about the work that's happening and receive updates, but also to provide feedback. As you may recall, one element of the work that we're doing includes continuous quality improvement through our evaluation activities. So that information will be really helpful to bring to this group to give you a sense of our progress, to help us identify what's not working, what's working really well, and drive perhaps future decisions for how the grant will be implemented. Stakeholder outreach and engagement continues to be a huge focus of this grant. And so one of the things that comes with the renewal are pretty in-depth, pretty stringent reporting requirements that talk about the partnerships that have been formed as a result of this work, how we've strengthened them, how we've deepened them, how we've created new partnerships, and how those partnerships support alignment and coordination across the system, perhaps new usage of funding. So we want to continue to have some of these conversations and leverage PQA as an opportunity to do that. We also want to continue to use PQA as a way to reach families. Colorado was incredibly successful in our first year, reaching out to families, providers, and other stakeholders, and largely due to this group. And so keeping that momentum going, ensuring that those stakeholders continue to be plugged in and inform the work will be important. And then really serving as a champion for the strategic plan. So again, looking at this, we'll have a beautiful copy come February, but there are some icons related to the strategies. So anything that has the little piece of paper icon next to it or the report is something that will happen under the preschool development grant. Anything with a raised hand is still something that we're looking to identify a champion for or a lead for. So PQA is an opportunity for us to start having conversations about those orphaned strategies and finding them homes, whether it's folks in the room or if it's folks here helping connect us to others who may be able to help us move those strategies forward. We also have funding within the preschool development grant, about $25,000 annually to support updates to the strategic plan. So as Colorado's landscape changes, again, as we learn more from our evaluation activities, coming here and having conversations about what those changes are, perhaps engaging a facilitator or others to support perhaps enhanced stakeholder outreach, is something that we will want to utilize the PQA group for. And then also going back to really that stakeholder conversation, identifying additional opportunities for alignment and coordination. So we do have an expanded partner list and some folks who may not currently be represented within PQA membership that we definitely want to plug into this work. So the Office of Early Childhood, the CDEP3 office will be doing some of that outreach, but it will also be important to bring those folks to this table so we can start having some dialogue and connections across programming, across state, local, regional groups to figure out what maybe some of those new alignments are. One thing that is missing from here that I should have put in is also sustainability. And so we are going to be required to report fairly often on the sustainability of the work not only completed within the initial year, but throughout the 3 years. As our federal partners say, we just can't kick the can down the road now that we have 3 years of funding. We really do have to be intentional about how we plan to maintain investments that we're making within the PDG. And so again, that's a conversation that I would love to bring to PQA and continue to have to understand what role everyone may be able to play to help us continue to invest in these activities. So I'm excited because I only had to present for 15 minutes today, and that really concludes. I know there's probably a ton of questions, and so hopefully we have a little bit of time for that. Again, I think more will be shared in February, March. We did receive a reduced budget. However, as we looked at revising that budget, it appears we're able to keep all of our strategies intact. So it doesn't impact our ability to implement what we proposed to do initially, which is pretty exciting. So with that, I'm happy to open it for questions.
So you just answered most of my questions. So did you just then, is the plan to just reduce all the activities by the same percentage line items, or how are you?
Yeah, so the choices around the reductions, one came from the fact that we have a no-cost extension. So we're able to use savings from the first-year grant to supplement So thinking about staff salaries, some of the activities that we would have spent on within the first couple months, we're looking at moving those costs under the no-cost extension so that we have a little flexibility. We also projected our indirects to be fairly high, and so that was an easy cut for us to make. The most significant cuts to activities are happening within the IT project. So initially, we budgeted about $5 million for the first year to support implementation of the IT strategic roadmap. Based on some additional cuts, we're only looking at about a 6% reduction in that budget. Again, that's probably fine. We expected to get a late start on those activities, so we felt like that was a reasonable area to reduce. One thing about this grant is we don't need to project our budget for the full 3 years. And so each year we'll be submitting a revised budget. And so there are some activities within this first year that we know are one-time investments that won't continue. So then any of those activities that we did reduce, we'll be able to then backfill in future years. We also will have the opportunity to roll over funds between years. That was not an option for the first year. Because it's considered 2 different grants, the initial grant versus the renewal. So we really are working to spend down our full initial grant amount, which we're very close to doing, which is great. But if we do have any savings within that renewal grant period, we will request the opportunity to roll those funds over. Yes, JC.
Have you all talked much about the process that we may use to have people kind of claim those areas with hands, or what is that going to look like to make sure that we are dividing and conquering to get everything done?
So no. I'm hoping that folks can spend some time, because our next meeting, I believe, is not until March. But really spend some time with this document, being very thoughtful about what that might look like for you or your organizations. And then hopefully, working with the co-chairs and with Amanda and Christina, figuring out what that may look like to have that conversation.
Hi, yeah, the IT roadmap, has that been shared publicly yet? I think there was a December timeline on that.
Yeah, so we are working on, one of the things with the IT roadmap is that it was completed in August, and so there's a number of bills that have surfaced through other PDG work that are not captured in there. So we're creating some context around that, but I expect to be able to share that out this month. Mr. Kuginski?
Mr. Orman? I don't have a microphone, so,
I think Emily's getting one for you.
Thank you. 2 questions. Thanks for all the information. We appreciate it. It's a lot of great details. I wondered if OEC is going to also produce a 1-pager that will make it simple and easy for all of us and anybody to really communicate effectively about it, simply.
I'd be happy to. Yep.
Thank you. And also on your point about expanding the PQA to have the most appropriate participants, and you said OEC, DHS is going to be looking at identifying those additions?
So we're working with the PQA co-chairs on identifying.
Great. Yeah, I think that'd be great. And if others have suggestions, if you guys would be welcoming other suggestions.
Yeah, and I think there's a conversation later today around membership. Yep.
Thank you.
Great. Anything else? Great. So in the meantime, you know how to reach us. If you have any concerns or fears about how the work's moving forward, definitely let us know. And if there's something you're particularly excited about and want to learn more about as well, feel free to reach out. So, thank you.
Thank you, Lindsay. Now we have an update on Senate Bill 1963, the final report from Amanda and Kristen.
Morning, everyone. We are really excited to share that the final Senate Bill 63 report is available. So we're going to go over a few things today. Since last time we saw you, we're going to update you on the process, share some of the recommendations, and talk about next steps. Right. As a reminder, we were asked to study the decline of family child care homes and infant care, that's both licensed family child care homes and infant care in the state, identify reasons for the shortages, and draft a strategic action plan for improving the recruitment and retention of family child care homes and available infant care. This is the timeline we shared with you last time we were here in September. Since then, we've highlighted the new areas. Since then, we've accomplished a robust stakeholder engagement process. I just wanted to flip to the next page to demonstrate our process. We had worked with Raise Colorado and the National Governor's Prenatal 3 to develop a remote toolkit for community conversations throughout the state. So you can see there was 18 conversations throughout the state, and this was just in a matter of a few weeks. So we had a lot of great input go into the report. Flipping back, from all those conversations, we compiled a list of 40 issues and recommendations, key issues and recommendations on the availability of licensed infant care and family child care homes. And we sent a support impact survey. That survey, we had people gauge their support and the amount of impact for each of these recommendations. We then took all of that information that we collected, plus the data, the stakeholder input, and compiled a small group of individuals to finalize the recommendations. The small group was made out of the entities called out in the report. So that was in mid-October. And then we also had our strategic plan authors. And then from that two-day meeting, they worked on diligently creating and writing the report. And then we submitted the report timely in December. So yay, we did it. All right, here's where you can find the report currently. We have it up on the ECLC website. I have it posted on an announcement across the homepage, so you can just click on that. It's also in the menu bar. And then it's also on the OEC website under the For Partners tab. You'll see it come up on the right side of the screen. I'll hand it over to Kristen.
All right, good morning, everyone. So we really want you to read the report. So what I am not going to do is tell you everything that is in it. It's very easy to read. The actual report itself is maybe about a dozen pages. And so I really encourage you to look at the full report, but I'll give you a brief snapshot. So just before we get into the actual recommendations that the small stakeholder group settled on, I wanted to take a minute to just explain the structure of the report. So as you'll see, for the recommendation pages, we begin with sort of a theme at the top, and then we state the broad recommendation that the small stakeholder group developed. So there were 5 key broad recommendations. Each broad recommendation, which is in the bold text at the top of the page, is then supported by different strategies that came either out of that small stakeholder group process or through best practice research by our authors. And then on the second part of each sort of theme, you'll find the narrative that explains why the group settled on this particular recommendation. Before we get into the actual recommendations themselves, just a reminder about what our guardrails were when we met as a small stakeholder group. So the statute laid out very clear requirements for what this plan needed to include. And so when the group was reviewing all of this data, all of the stakeholder input, they ensured that whatever recommendations came out of that process complied with what was required by the statute. And that included strategies related to reducing obstacles to obtaining and retaining a family child care home license, strategies to address reasons why providers stop operating licensed family child care homes, strategies that address reasons why both family child care homes and provide infant care, and then also laws or policies that had to do with that local regulatory context, so the building code laws, the zoning laws that affect the availability of family child care homes and infant care.
All right, so getting into the 5 key recommendations. So the first is under the theme of operational support, and the recommendation here is to provide financial, business, and professional support to prospective and existing family childcare homes and centers serving infants. Something I want to highlight here is it's not just existing, it's prospective providers as well, because one thing we heard is that there are a lot of folks who are interested in opening, and then they find that they're running into many barriers, and they don't know how maybe to operate a successful small business. They don't know about existing resources that are out there to help them, so we wanted to focus both on prospective and existing providers. So an example strategy under this recommendation is to provide business consultants or navigators for pre-licensing. And again, this is to help those folks who are interested understand how to reach out to small business majority, where they can get guidance and free coaching on payroll and tracking attendance and invoicing, and those things that we found a lot of care providers don't necessarily think about when they're coming into the industry. They want to care for children. They're not thinking necessarily about that business side, but that business side matters a great deal when we think about sustainability. Another example strategy under this broad recommendation is to fund local partners to create staffed family child care networks or microcenter networks that would support recruitment and retention of those providing infant slots. So we know staffed family child care home networks can help reduce that sense of isolation that family home providers feel. And that was a big issue that came up in our stakeholder outreach, was just, you're in the home with children by yourself all day, every day, not feeling that sense of network and support that's specific to the type of care you're doing. And then also the microcenter network, which is sort of an emerging idea that we thought was worth exploring to allow folks to more sustainably access high quality infant care. So we have a page in the appendix that explains both what a staff family child care home network is and what a microcenter network is, but just as a brief snapshot, it's sort of a hub and spoke idea of childcare licensing. So you have an entity that may exist here that holds a license and is responsible for professional development and things like that of teachers, and they may be responsible for these spokes of classrooms. So think about a classroom that might exist in a elementary school, for example, or maybe a community center where it's just one classroom, one teacher or two teachers serving infants and providing that care, but not requiring the full facility, so taking advantage of existing facilities. That recommendation would require a look at the way that we currently license providers, so that's in the recommendation, as well as to take a look at the regulatory scheme for licensing. If we decide as a state that's a good strategy to go down. All right, professional development is the theme of the second broad recommendation, and that broad recommendation is to increase access to training and professional supports that enable infant care professionals and family child care providers to provide high quality care. And one example of a strategy under this is to provide additional professional development that's specifically relevant to family child care home providers and those serving infants. And this came out a lot in that stakeholder engagement process, which is there are professional development opportunities out there, but maybe they don't speak to the experience of a family child care home provider. So if a home provider wants to learn about how to implement positive behavioral support, they need to understand how to do that in the context of a mixed age group. A lot of what we have right now is geared more towards centers where it's sort of age specific. So we're not necessarily meeting those professional development needs of home providers. And then also, when it comes to caring for infants, we know that that's a much different task than caring for 4-year-olds. So we need to have training. We have EQIT. We need more of it. We need more training opportunities similar to it, so that folks who are doing that really important work of nurturing that young infant mind have all of the resources available specific to that task. The second strategy under this broad recommendation was to review and revise how frequently we're requiring certain trainings. And one thing we heard there was a lot of consternation, I would say, from providers about having to repeat the same training every single year. And they felt like, you know, within the context of professional development, some of those things don't need to happen every single year. If we could switch it up and open it up more, then they would be able to take advantage of more rich learning opportunities rather than sort of redoing the same thing. So that was a recommendation under this particular theme. The next theme is childcare licensing, and the recommendation here was to add resources to the childcare licensing process to increase support and training to providers and decrease time to obtain a background check. One of the recommendations, or recommended strategies rather, in this section was to increase the number of state-based licensing staff so that licensing staff can be champions and supports and technical assistance providers and quality support specialists, in addition to doing the inspection process for providers. So right now, caseloads are so high, we're at 1 to 85 in the state, and best practice is 1 to 50. And what we heard from providers a lot through the data we collected through surveys, through the stakeholder engagement process, is they kind of looked at licensing as just the bad cop, and not really giving them the support that they need to be in compliance. And that's something that licensing staff specialists want to do. A lot of them used to be providers, but they simply don't have the time right now other than to comply with that annual licensing check. So we really would like to see more investments in that licensing department to be able to broaden the scope of what specialists are able to do with providers. Another big thing we heard was that for folks who are interested in opening their own home or starting to care for infants, or even if they're switching to a different provider, the length of time it takes to get that background check is just too long. And that has been a big barrier for folks in terms of getting up and running. So we already know we don't have enough early childhood educators and folks who want to do family child care homes. So if folks are interested, we need to be reducing the barriers to get them going. And that's where that recommended strategy came from. The next theme is around regulation. The recommendation here is to clarify, coordinate, and resolve differences among state and local regulatory agencies, to remove administrative and financial burdens, and assure safe environments for children in family child care homes. So this really got to that local regulatory scheme and the fact that family child care homes in particular, if they comply with child care licensing, may not be able to open because it may be that in their particular city or county, they have additional recommendations that come through zoning laws that make it either very difficult or nearly impossible to open. And also, there may be homeowners associations rules that just say you cannot operate here. And that's something that really emerged through our stakeholder input, particularly, I think we knew about the zoning and building code issues, but hadn't really considered the HOA problem. And so one recommended strategy here is to require the Office of Early Childhood to work on a regular basis with other relevant state agencies, professional associations, these sort of local entities, to come together and develop a coordinated strategy around policy changes, make sure we're informing each other when changes occur and discussing how that might impact the availability of care, cross-training, so those local folks are aware of all that goes into child care licensing, establishing the importance of infant care and family child care homes, and understanding, again, how these local regulations might affect the availability of care. The next thing I want to highlight is just one area where we did not have complete consensus in the group. So what we did is within the narrative section of this particular part of the report, we highlighted two competing strategies. So one is to have legislation, statewide legislation that would require local regulatory entities to treat family child care homes as residences for purposes of those local regulations, so not requiring fire sprinklers to be installed, for example. And then also requiring HOAs to allow regular family child care homes. So basically saying to HOAs, you're not permitted to completely prohibit family child care homes altogether. The competing strategy here was to take an approach of education before legislation. So to say we should educate local entities and HOAs about the effect of their policies before we implement legislation. The final theme is around policy, and the broad recommendation here is to examine how early education and other policies impact the availability of infant care and family childcare homes. So one recommended strategy here is just to ensure that we're thinking about how we support a NIC delivery system when we make state policy around early childhood care and education. So knowing that how we structure policies may affect the ability of a center to continue to serve infants, may affect the ability of a family childcare home to continue. Just really ensuring that we support that broad landscape and provide parents with all of the choices that they want and need for the care of their children throughout their lives. And then finally, requiring the ECLC to basically continue the work that we did in the small stakeholder group. So this strategy suggests that the ECLC is sort of the right body to continue this work of reviewing how do we continue to review policies, propose policies that are going to expand access to licensed infant care and family child care homes. And then, how are we doing on time? We don't know where. Oh, man. Okay, I'll go so fast. Further recommendations. So we had these 5 broad recommendations, couldn't help ourselves, had an additional couple of recommendations. So that's sort of the last page within the Senate Bill 63 report. One I'll just highlight is to look at the family child care home requirement. Right now it says you can care for no more than 2 children under the age of 2 years old. Our stakeholders felt we could change that to no more than 2 children under the age of 18 months old. And by doing so, expand access to infant care, particularly in home settings. And then finally, the appendices are a rich area of lots of information. The report itself is about a dozen pages. The appendices are probably closer to 60 or 70 pages. So much good information. So here's an example of what you'll find there, but definitely take a look. And then Amanda.
Okay, for next steps, we are working with the NGA Prenatal 3 grant in the governor's office to develop an advocacy toolkit based on the Senate Bill 63 report, including 3 unique one-pagers for different audiences. The audiences are families, caregivers, and policymakers, and then we are developing a social media toolkit. We are also, as Lindsay announced, that we are planning on doing some statewide meetings to share the strategic plan and needs assessment. We will be sharing the Senate Bill 63 report at those meetings as well. And we are looking for PQA and our partners and stakeholders in these rooms to really take these recommendations and run with them. So feel free to reach out to us with any questions, and we look forward to continuing to work with you guys.
Thank you.
Thank you very much.
Yeah, Clark, thank you for that information. It was great. Thank you for that information. It was great. Could you please clarify who officially the recommendations are from?
The recommendations are a result of the small stakeholder group. So the legislation asked us to convene entities and reach out to entities to develop recommendations, so they belong to the entire state of Colorado. They came from the state, they came through stakeholder input and outreach, and they came through the stakeholder recommendations.
And so they're the stakeholders' recommendations, not officially the DHS recommendation.
That's correct.
Thank you.
There's another question, I think.
Oh, sorry.
Hi, one more question. So before this strategic plan happened, there were a lot of presentations with data around infant and toddler capacity, right, family child care home decline. I think some of that data is available online and some of it isn't. And for folks in perhaps the business communities or communities outside of early childhood who want the Cliff Notes version of this, right, that has core data that's important for us to make sure the general public and our partners know about. And then number two, the solutions to address some of those challenges we're seeing. Is such a document available, number one, and number two, if not, can we create that?
Yeah, I think the one-pagers that Amanda mentioned will get to some of that, but in terms of the specific numbers of the time, we'll have to make sure that that data point is actually reflected in there. And I will say too that in the appendix, we have a report from AJ Chaudhry and the Cradle to Kindergarten team, which goes into more detail about in a world of no accessibility or affordability constraints, how many infant care slots and how many family child care homes would we need to fill the need. So I'd encourage you to take a look at that report as well. We'll also have additional data around that coming out through our needs assessment through the PDG process.
Okay, that'd be really helpful, because I know that there were some numbers initially put out that now I think are a little more fuzzy.
We have more concrete figures.
Okay, that would be great, yeah.
Can I ask just one quick question too? To what extent are any of the recommendations that this group came up with currently slated for inclusion in the PDG funding? Like, is that,
Yeah, thank you for asking that. So I should say that all of the strategies from this report are included in the statewide strategic plan that was developed through PDG. We're very intentional about aligning those two processes. I'm working right now on a crosswalk of the strategies in Senate Bill 63 and what we have in PDG. So I want to defer my answer on that once I have that done and approved. And that would be something that we will be sharing with folks so we know what's being covered, similarly to what Lindsay mentioned with the strategic plan, who owns what, who's already working on what, so we can figure out which pieces need to be picked up by advocates and other organizations. Yes. Any other questions? Okay, thank you.
Thank you. So our next item is the Family Act Coalition information from JC and Hunter.
Hi there. So I'm Hunter Rayleigh with Small Business Majority.
And I'm J.C. Montoya Price with the Colorado Children's Campaign and the Raise Colorado Coalition.
So with this presentation, we're just hoping to cover, give you a quick update on what's going on with the conversations around paid family and medical leave. So that includes the task force update, and then also specifically the Family Coalition that is working on the bill. So if you want to give me the overview.
Okay, sure. So Raise Colorado is a new member of the steering committee for the Family Coalition. This group has been working together for 5+ years to try to get a paid family and medical leave program passed in Colorado. It's composed of diverse stakeholders, including business leaders, community members. We have some people at the table who are there for educational purposes, who have expertise in this area, trying to make sure that we pass a program in Colorado that is sufficient for our workers.
So just a bit about Small Business Majority. We're a national organization with an office in Colorado. Our primary focus is to educate business owners and help them engage in that resource navigation. And then we also work on the policy side, and we sort of construct our policy positions based on scientific polling of small business owners, and we define them as employers with less than 100 employees. The top issues for us have, in I think most small business owners, has always been access to capital, retirement, healthcare, and then broadly speaking, employee benefits, and more specifically, affordable employee benefits.
And I think most of y'all are familiar with Raise Colorado and the Colorado Children's Campaign, but just because there's new faces, the Colorado Children's Campaign is a statewide, nonpartisan, nonprofit organization that does research, advocacy, and policy work to ensure that every child in Colorado has every chance to succeed. The Raise Colorado Coalition was convened by the Children's Campaign, Clayton Early Learning, and a diverse stakeholder steering committee to look at prenatal infant toddler issues. We know, and there's amazing work going on right now in Colorado for preschool and up. Sometimes we pass over the prenatal to 3, so we have been a noisy voice for that audience. So I think here I'm speaking to the choir in a lot of ways because you all know more about child development and well-being than probably I do, but I wanted to just do some level setting and some sharing about the benefits. I would say one of the things to me that's really been highlighted is in A.J. Chaudhry's Cradle to Kindergarten. Paid family and medical leave is identified as an essential component of ensuring strong child well-being. But we know it has lots of impacts on both the parents, the child, and some real ones, like infant mortality. Y'all know that our brains grow faster in that period of 0 to 3 than any other point, and that means that those relationships that young people, children, babies are forming in those first months are really essential to their future educational attainment, to their mental well-being, and all the relationships that follow. Because of the association we have with infant mortality, and knowing that paid family leave can also reduce maternal depression, we really think this is important. The time there that paid families can spend together allows them to really establish that breastfeeding relationship, go to those what seem like hundreds of well-child visits, and ensure their kids get all the immunizations they need. Let's see. There's some maybe some benefits are a little harder to tie directly, but are also shown from the research to be relevant here. The fathers who are able to take some paid family leave are often more involved in the child's direct care after the birth. We also know that involved fathers to promote children's educational attainment and emotional stability. One of your all goals, I know our goals as a community, is to support school readiness and economic self-sufficiency, and paid family and medical leave is one of those proven programs to do that. It ensures that children grow up in families that are financially secure, which obviously or logically impacts their healthy development. We know that the stress of poverty for children and their families can impact their ability to thrive. This early childhood period is the time that young people are likely to live in poverty. Something like paid family leave might be that difference that gets them over the finish line. I just saw some research yesterday from Sarah Barnes on our team that even a $3,000 increase in income in the first 5 years of a child's life can have really tangible benefits in terms of academic achievement, IQ, and something else. I just read it yesterday, I can't remember. And like I said, paid family leave helps with income stability. In one study, it showed that moms who took leave were 39% less likely to receive public assistance and 50% more likely to report a wage increase in the year following birth compared to women who didn't take any leave. So tying this all back to our common goal of realizing that the aim of the early childhood framework, we know that this program supports improved family health and economic security. It is a 2-generation approach. And so that's the third area of opportunity in our areas of opportunity that ECLC created. And I would argue that there's some more indirect connections back to the first two that relate to quality early childhood environments, as well as workforce development. So with that, I'll turn it over to Hunter to talk about the task force.
So you're probably aware last year we didn't wind up with a program. We finished with a study bill that called for a task force to do an in-depth look at what paid family leave in Colorado might look like. So the task force was made up of 15 members. 2 were non-voting, and those were CDLE appointments. The rest were a mix of appointments from House and Senate leadership in the governor's office, and they included business voices, organized labor, worker advocates, public policy professionals. I believe, I don't want to say Colorado ski country, but ski area on this task force, as well as private insurers. So the task force convened between July and December of this year. In so many words, what they analyzed 16 policy levers that were identified in last year's bill, and they developed recommendations for a actuarial analysis. Where that analysis landed was they created an upper bound limit, so that was 28 weeks, including bonding, just to see what that would cost, and then they created a low benefit that was 12 weeks and had looked very similar to what was being recommended in the bill last year, but it had a slightly higher benefit than what was in the actual bill language. These slides are going out, correct? So that hyperlink, you will be able to see the report. The task force started off a little bit contentious, but I think once they got in, it really, as you can see from this slide, they were unanimous on the majority of the recommendations. So the key things that came out of that recommendation was based on available data with a high degree of confidence. They thought that CDLE should have oversight over the program and then be allowed to use third-party vendors for areas where they feel less comfortable. So IT systems, maybe claims processing, that type of thing. Additionally, the best structure was felt to be what's called a social insurance program, where everybody pays in. It levels off premiums for everyone. There's no risk rating, so it's just a giant pool. And then wages are replaced out of that fund when people have a qualifying event. Additionally, I think there was a lot of consensus around what qualifies as a qualifying event. I think there was a lot of discussion about what the definition of family was going to be. And I think where the task force landed was on the wage replacement, or who was going to pay into this fund, that employees should pay for it, with the idea that if it's an employer-employee split, that's not really a split, it's coming out of the employee's pocket anyway. So there wasn't really a sense that employees had more of an obligation. They just, I think the conversation landed on this is essentially where the money's going to come from anyway, so that we should just go with that. Really critical to that was, I think there was unanimous agreement around equivalent plan opt-out. So if you're an employer, you're already offering 12 weeks or whatever this baseline benefit is, you should not feel obligated, or nor should you be forced to opt into the state plan. So with some certification process, you would be able to continue doing whatever it is you're doing without penalty or interruption. Self-employed workers would be able to opt in, and I think the big thing that was really in addition to what's not currently in federal law is the inclusion of domestic violence victims as a qualifying event. This goes beyond what is currently in federal law. FMLA simply provides job protection for up to 12 weeks, but makes no requirement that you receive wages during that time frame, and that only applies to employers of 50 or more employees. And for a bit of context, 95% of employers in the state of Colorado are under 50 employees. It's not 95% of the workforce, but that's 95% of the employers in the state. So again, you can find all the task force materials at this link. I would also encourage you to look at the expert reports. So as part of this process, several expert reports were requested, one coming from the Urban Institute in Washington, D.C., the University of Minnesota, I believe, and then another local one coming from the University of Denver with Dr. Jen Greenfield. In addition to that, the actuarial analysis, full policy recommendations, and a full list of the votes and where people landed, and as well as dissenting opinions on each of those votes are also included in the report. So to jump over to the coalition's policy considerations right now, and I'll let JC talk a little bit more about what Work 3A's but I think the big thing for us is really to just sort of highlight that paid family leave and clarify some confusion, that paid family leave is a distinct policy from PTO, flex time, or other employee benefits. So again, many employers already offer this type of benefit. What's distinct about paid family leave is that there is a job protection component. So everybody has something in their life that happens. At some point they may need it, but they're not necessarily going to need the 12 weeks. What distinguishes this is there's a guarantee that you will have your position when you come back to work. Without that, if you are an employee in a business under 50, there is no guarantee that your position will be kept for you if you come back to work. Additionally, I think we've spoken a lot about infant toddler considerations and early childhood development here, but I think there's some other things to mention. That paid family leave extends beyond simply childbirth and bonding. This includes serious personal health issues as well as serious health issues in your family. So right now, I think as a public health consideration, we're also facing a caregiver shortage, and a lot of that is falling on children to take care of their parents or their grandparents. And these are the types of job protections and wage replacement items that help people keep their jobs and maintain a flexible work schedule in cases where a grandparent or their parent, as they get older, just has health issues. So that's just important to keep in mind moving forward. And I'll let JC talk more about the core coalition policy considerations.
Thank you. If any of you have been following the events at the Capitol this week, you know that the legislative session has started, woo! And, you know, as part of that, the governor made a State of the State address, and the House and Senate leadership all made speeches. And it was really exciting to see that the governor talked about support for paid family leave, and House Majority Leader Casey Becker talked about its support for paid family and medical leave. So this is an exciting time. What we know from the research and reports and data that has been collected by the task force is that what program we adopt is essential to having the impact that we want to have. We don't want to exclude low-wage workers. We want to ensure that female-dominated sectors like early childhood and education or healthcare aren't paying higher premiums due to gender reasons. So we have this little mantra of the 3 A's, and there's a handout available for that. I think you got it at the back. So the first is affordable. Next, accessible and adequate. So what we mean by that is, you know, if it's affordable, we need the lowest premium possible so that it's affordable for those people who are just getting by, and for the small businesses who desperately want to offer competitive benefits but presently can't because they're too expensive for their small margins. Accessible. We want all workers covered because everyone will face some sort of life event. I'm glad that Hunter mentioned the fact that this is not just about babies. We are all about babies, but this is also about children with special health needs who parents need to take time off to care for. This is about taking care of your parents, yourself, and the majority of leave actually is for people taking care of their own personal health needs, as we've seen across the nation. We want options for self-employed people. That is kind of where our business world is going, and so we want to make sure that contractors and freelancers can get paid family leave as well. And something is portable. Again, you know, we know how often people move jobs, and if you're stuck in a job because you don't have the option of moving to get paid family leave, that can have detrimental effects as well. And finally, adequate. You know, we want it to be long enough to meet the diversity of needs. You know, when you go to this website and see all the expert reports, the department, CDPHE, did an awesome job of showing if you want these health outcomes, this is how many weeks you should offer. If you want these health outcomes, this is how many weeks you should offer. I'm the squeaky wheel that says, actually, the data shows that for the birthing person's well-being, you should have 26 weeks, and for the well-being of the child, you should have 52 weeks. I'm not that radical, so, you know, the 12 to 14 that have been batted around would be amazing, right, compared to what we have now, which for some people is absolutely nothing. And
And yes, so covering who you love, the recommendation from the task force that is people related by blood or marriage. They did not include the extended family. And so we're also already, as a coalition, seeing areas where, is cooperation going to be necessary in order to get something passed? And how can we work together to find something that works for everyone's needs? It pays enough that you can actually cover your bills. I think one of the East Coast states recently updated their policy because the wage replacement rate was so low that no one was taking the benefit. They couldn't cover their rent and their childcare expenses and all of that, and still take that leave. And then, as Hunter has mentioned, it ensures that workers won't lose their jobs. Job protection is an important element. So we're almost to questions, but before we do that, I wanted to make sure you all know how you can raise your voice on this issue. And I want to wish you a happy Family Friday. One of our efforts is each Friday of the legislative session, we're encouraging advocates to speak up in favor of paid family and medical leave. Today is a call-in day. If you go to the Raise Colorado website or Facebook page, you'll see a sample script to call the governor and your state legislators on your own time. This doesn't have to be work-related lobbying, to let them know that you support paid family and medical leave and why. So I really want to emphasize that, we all can take action as individuals. Also, our organizations can take action. And there's a lot of advocacy opportunities that don't count as lobbying. There's a lot of education that can go around this report and how do we make sure that people understand, leaders understand the recommendations of the report. Similarly, the education piece. I'm sure we all have a story in our networks of someone who took leave and that made the difference between, literally life and death for them and their family, or were not able to take leave and the hardships that created for their family. So, educate everyone that you'd like to. I'm sure my family's going to get sick of hearing me talk about paid family leave. Help us tell stories and join the Family Coalition. We are in the process of updating the website. It's cofamily.org, and we'll have an opportunity there for people to join the coalition, both as individuals and as organizations. A final opportunity for engagement I wanted to make sure you all have on your calendar is Speak Up for Kids Day at the Capitol. While paid family and medical leave will likely not be one of the big bills that we're lobbying that day, our attendees and advocates are more than welcome to cover whatever issue is important to them when they meet with our legislators. So Speak Up, March 12th is going to be amazing as usual. Senator Rhonda Fields and Representative Colin Larson will open the event and help people understand how to be most effective with legislators. Our own Akani Ogren will be doing our keynote, sharing her experience both as someone who has relied on accessible childcare, as well as who's training the next generation of our childcare providers. And then we're going to close the day with Carol Hedges from the Fiscal Institute, talking a little bit about Vision 2020 and the needs for fiscal reform in our state. So with that, we're going to take questions. Go ahead.
For the option for employers to use what they currently have in lieu of the state plan, was that recommendation also requiring that it at least meet the requirements of the state plan?
Yes, and that was included in last year's bill language. I think the reason the task force considered it was just really to clear the air, because I think there were something like 80 amendments to last year's bill, so and some of that got lost in the mix. So I think everybody just wanted to be clear that if you have a plan, it meets the state minimum, you can opt out. Or I don't know what we're going to call that, but if there's an equivalency there, that will be available and you can use that.
And then is there, I know it's early, but is there expectation that the task force recommendations will be those that were unanimous, sort of folded into legislation that we know for sure is coming out, or?
So I would say I can't offer any specifics right now, but I will say that if you've read any of the news coming out, that I think the task force, largely clarified some things we already knew, and I think specifically on the who pays for it part, advocates sort of were made to understand that, again, like, it's going to come out of the employee's pockets. Let's just have it 100% employee funded. But I'm not really under any impression that just because the task force has issued a report that people are going to feel any obligation to follow it. So.
So one of the things, looking at some of the votes that you guys had for the process of your recommendations, was in regards to exemptions. And I know one of the things that a lot of our members in the Early Childhood Education Association fear is we are already in such a shortfall of qualified employees, and where no one in our field would say, you know, no, you shouldn't have 12 weeks with your baby. I mean, that's, you know, we're in the field of babies. That's our passion, and making sure that families, you know, have that time together is very, you know, close to our hearts. But we also realize we've got to staff our centers, and we've got to have employees there. You know, were there considerations for these kind of industries where you have a ratio requirement and credential requirement, not just in early childhood, but in youth crisis centers, in, you know, for CNAs, these kind of professions that are already struggling to find employees, you know, 12 weeks off could break a center. So,
there's a lot in there, and I'll, just at a high level, I think we'll have to provide some clarity around what an exemption means and what part of the program specifically, and I think the job protection piece is what you're referring to with licensed professionals. It's simply that, and it's acknowledged that, you know, if you're relying on a ratio to keep your facility open, that's just not going to be possible in some cases. So I think, but that's an example, and I think we're just going to have to be more specific. The task force itself didn't get that far into the weeds about where that needs to be, so that's going to be a point of discussion. And from my perspective, my whole concept around this is going to be a really critical benefit for employers, but if there's no business, there's no benefit, is sort of how I'm processing it. It also puts us in a very odd place where when we're talking about specifically this type of exemption around job protection, the people that are most susceptible to this are people who are licensed professionals. So childcare providers, anybody that has to carry a professional license and is relying on ratio, or you could even think of a scenario where if you're like a software professional and you hold the license for your company's protocols or whatever, that's where we're really seeing the issue. And I think what I will say is I think we can do better than a cutoff at 50, but I don't know if it's feasible right now to go say universal, or if anybody's really willing to say universal right now, just knowing that those considerations are out there.
And I would just add that the way that Raise Colorado has perceived this, it really is as maybe more long-term a workforce development opportunity, similar to the state retirement savings plan or the public option, right? Where because benefits can be so expensive, especially when we do risk ratings, that that's where a lot of our people are getting dinged. And so long-term, the goal would be, right, that would make childcare providers more competitive than other places, and so people would be able to come back from leave and be your staff member long-term. But yes, obviously, we have a whole other workforce, and we have a whole bill around it of making sure we actually have enough physical bodies that are qualified to do it.
Sure, and I think just to kind of conclude, I think again, it didn't go too deep into the weeds with the task force. It was more just getting some consensus around where people are at on these specific components. Going deeper into the weeds, I think really the thing that stood out and what has proven to be most critical from an actuarial perspective and a financial perspective is how the program's administered. So that really, I think, what's going to be at the root of the conversation this year.
And I just wanted to add that, I think it was like 2 years ago, we passed a bill that created a substitute license type. And I wonder if we could get like Erin Mawhinney or someone from the office to come and give us an update on like, are people using that? Are there substitutes? Like that kind of thing, because I think if that's not working, then we need to figure out either an implementation strategy or a different strategy for how we license substitutes, since we have to have an entity license instead of a person. And I know we're thinking about maybe making background checks follow the person. And so are there other things that we can do like that? Because then there would be a pool of substitutes and there wouldn't be this issue with it, so.
Other questions? I think we're like just about at time. We can probably take one more. Okay. Well, thanks everyone. We look forward to keeping you all engaged in this in one way, shape, or form. And, Raise Colorado will be sending regular updates about this. I provided in the back the Children's Campaign legislative priorities as well as the Raise Colorado, and you'll see paid family and medical leave state administered is on both of those lists. So we really do see this as an essential issue for achieving our goals. Thanks.
So thank you, JC and Hunter. We appreciate the update. So next on our agenda is an update from me, from the Colorado Department of Education. I wanted to give you an update on the Kindergarten School Readiness Initiative that's been in place since the passage of Senate Bill 212 back in 2008. So within the Senate Bill 212, which is also called Colorado's Achievement Plan for Kids, CAP4K, there is a provision that all local education providers, so school districts, need to ensure that kindergarteners have a kindergarten school readiness plan that is informed by a kindergarten school readiness assessment. The notion here is not that we would say you're ready, you're not ready, and say that children can't come to kindergarten, but instead kind of flip so that we think about how do we ensure that our schools are ready for the children that we have, and that kindergarten teachers and their families have really good information around key indicators of school readiness and regarding areas of physical well-being and motor development, social and emotional development, language and comprehension development, cognition, and general knowledge. So that initiative has been in place for a number of years now. The Colorado State Board of Education is responsible for a few aspects of the Kindergarten School Readiness Initiative. One is to define school readiness and to update that definition regularly, in which it has done so. But another piece is around what do we do with the data that comes from that kindergarten school readiness assessment. So we know that that information is really critical for families and for teachers to support children in each of those areas of school readiness. But there also is some utility for that information for policymakers, for local communities, for the state, to look at how well are communities preparing their children for kindergarten. So there is a provision where the State Board of Education is required to adopt a system for reporting that kindergarten school readiness data. The State Board acted on that back in 2000. Let me just quick pull my slide here. I can't remember the date, the years. In 2016. The legislation indicates that that information would be made available at the school and district level, and that it would be aggregated, obviously, so no personally identifiable information would be made public. The board at that time was in the middle of a real challenge, I think, that was happening nationally around concerns about data privacy and data security. So time the board voted to adopt a system that not only was aggregate information, but also would not indicate the particular domains, information about particular domains. So for instance, there isn't a reporting on what is the physical and motor development readiness. Instead, all of those domains, the board voted to mask those domains and instead just report out on how many domains that students or children are meeting age expectations. So this has been in place now for a couple of years as we've been able to implement. And there's been a number of questions about how useful is that information. If a community is unaware of what those particular areas are where they might be able to support children, for instance, it might be in terms of language and literacy development. They really can't act. Instead, they would need to go to the local school district and say, hey, let's look at, let's talk about your data. So there has been, back in the summer, there was an article in Chalkbeat that really looked at that and started to question and say, is this the best way to report this information? And the chair of the state board has requested that CDE bring this back to them for discussion at their February meeting. That's when we're planning to bring this forward again, with the idea that the board may consider revisiting that. And so we are preparing for that presentation for the February meeting. We are aware, though, that after yesterday's board meeting, there's now another hearing scheduled for February's meeting. One item is kind of being pushed to February, so now that meeting is becoming even more full. But right now, we are still assuming that we're on the agenda for February. If the board does decide to take action and change the parameters or parameters for that reporting, they typically don't hear an information item and vote at the same meeting. They typically hear an information item and the following meeting vote. What that does is enables stakeholders to weigh in with their respective board member prior to a vote. So if that goes according to schedule, if in February, if this item is presented, and then if in March the board does take this up for reconsideration, then we would certainly share that with you, but I just wanted to give you that update. And then also just a really quick plug too, the Colorado Preschool Program Annual Report will be released very shortly. It's due to the legislature on January 15th, and we are in the final processes of getting the review complete. So we're really excited about that. It's something that we're really proud of, is the continued success of the Colorado Preschool Program, which funds preschool for close to 30,000 children. We continue to see really great results. We continue to see children who are funded through CPP have a reduced percentage of grade level or grade retention. So students are retained at a lower rate. We see fewer students identified with significant reading deficiencies, and as our longitudinal data system continues to mature, we're seeing that there's a higher graduation rate for children who are funded through that. So it's a really, it's something that we're all excited about. We know that it takes many, many partners for that success to happen. So if there's any questions, I'd be happy to take those. Yes.
Hello. So quick question, as a parent of a kindergartner who's actually going through readiness assessments this year, my daughter had been in early childhood programs previously who also used Teaching Strategies Gold as a developmental assessment, and she had, a long track record of assessments and information in that system. And so I was pretty bummed out as a parent that when she went to kindergarten, none of that information could be carried over. And we really, as parents, can't see the progress she's made from birth to now kindergarten on that system, and the teachers and the school districts obviously have no capability to, bring that data together at all either. So is there a conversation about child data and how we could look at, of course, maintaining privacy standards for children and families, but at the same time also reaping the benefit of longitudinal data for children and families? And I know that DPP goes through pretty painstaking processes to collect data on children and keep that straight, but I'm just wondering if that's been a conversation at CDE.
So that's a really good question. We have had conversations with the publishers of the different assessments. And I think at this point, there would need to be agreements between the local programs in the school district for data sharing within that system. The state itself has no role in those contracts. So that would really have to be kind of a local agreement that would have to happen. And it is a challenge, because imagine your Denver Public Schools. Imagine all of the different programs which could feed into that. And so obviously with DPP, there's probably at least a better kind of system in place, or at least a single entity, or I don't know how everything works. I'm just making that up. But imagine, okay, thank you. But just imagine, there are some real challenges with that, but really that, unfortunately, is not something that the state has a role in. That really would be a local agreement between the contracts that folks have. Yes.
I'm just wondering, I'm also fairly new to the state. Do we have a way to track children who do not have any preschool, formal preschool experience? Do we know when they come to the school where they're at all, on any form, anything at all, anywhere?
Yeah, so
because I just came from Oregon, where we put this on a form, and it was amazing.
Yeah.
So I was curious about that. How do we know who's coming in? Yeah.
Right, so they're actually, and I know that Scott would probably want to talk extensively about this, but
quick answer.
Right, a quick answer is we don't really have a state longitudinal or a statewide system for all children prior to entering the public school system. Those children who go through the Colorado preschool program do receive a state-assigned student identification number, and we do, I think, have agreements with a few Head Start programs as well. We do have an ability to kind of look at, through a data sharing agreement with Human Services, we can start to look at and understand how many students are receiving different funding streams, whether it's CCAP or participating in different programs, and we can get a sense of that. And so we don't necessarily need to have an identifier, but because we can still link those, we can still link data to get a sense of how many children are. That information is more of a place of kind of, we've done some work to have like proof points that we can do that, but we haven't, data privacy and security, I don't know how big that was in Oregon, but we have some.
It took a long time.
Yeah, it's a real challenge. Yeah, it's a real challenge, and it's a real concern, I think, for some families. There can be a lot of resistance to it with the notion of from that point of view, why does the state need this information? And there can be that concern about, just what the state knows about families.
Right. Thank you.
I don't know if you want to say anything else.
Appreciate your. Thank you. Appreciate your question to Nicole. And as Melissa said, there have been a lot of discussions. You said it took a long time in Oregon.
Very much.
And as people have been hanging around me for a while know, I've been emphasizing a bill that was enacted into state law in 2008 that requires a unique student identifier for all Colorado children receiving any public funds, including and explicitly CCAP and Head Start. And there's the implementation of this law, noting the challenges that Melissa mentioned, has taken a while. and it's not fully implemented. But the intent of the law goes to very much about what, and maybe a little bit what Oregon did, and to what you're asking too about, Nicole, and looking at the linking of the data from the early childhood system to the K-12 system, so that the public, administrators, the local and state levels, policymakers, teachers know the impacts of each program on K-12 outcomes and activities, so that also that practitioners can address concerns and how children are progressing, and also that we as a state know, and most ask a really important question, why are we doing this? In this legislature, there was some intent discussed publicly back then in '08. The Colorado Children's Campaign was the lead proponent at the time, and I was working there then, so not specifically on this. And a lot of it is to have a better understanding of the impacts, so we know what's working and how and why at both the macro and micro levels. So we are working, as Melissa mentioned, DHS and CDE, we're working together in the governor's office to try to, as you said, proof points to show that this can be done, is being done. It might be great to hear more about what's happening in Oregon and other states so we can help inform us. But you're right, it takes a long time. We're now in year 12. Was not fully implemented.
There's one question on the parents' form. It took 1 year to get one question. Yeah. So it was quite the process, but it was really, really wonderful to learn about those idiosyncrasies of why you need to know. I mean, just the language, take this one word, and it was incredible. So just curious. It was a really exciting process because we could catch those that were unknown, right? They don't have any funding. They're being cared for by their grandparents. All of those unknowns were able to kind of rise to the top of the table and catch them. And the second part of that work was establishing, once they're identified, establishing a 3-week period prior to kindergarten. And establishing some funds that gets parents and children, and they get in there and they practice. And these young ones who have never been in a structured program were the leaders in their kindergarten class. I have all the information if anyone's interested. I'd love to forward it to you. It is still going strong. It's a fabulous program. So I still am championing this work from there. And it was in Portland. It wasn't in the state level. It was all of the districts around Portland contributed through a collaborative, right? So it's exciting work, and I would love to share that too with you.
I'm sorry, Melissa. I'm really sorry for interrupting, but one more quick point, 3-pronged point. I'll make it quick. Is that first of all, I just want to thank you, Melissa, and who's shown exceptional progress on this KRA issue, kindergarten readiness assessment. This is a really important first step, and the questions about individual student data, they'll be ongoing, and we're going to be looking at that. I want to express that appreciation to you. And second of all, that as we know, the SASTA, the identifiers are intended to shield students' privacy, not to expose it. And so that's something that the legislature was very conscious of back in '08. We want to keep that in mind. And third of all, just the main point of all this is to help children succeed in school. When we ask why are we want to look at data, is to help understand and help early childhood promote success for children in school. Thank you.
Thank you. We have next on our agenda working group updates. So the first is the Professional Development Advisory Group. So,
great, yeah. So hi all again, Heather Craiglow, and I'm 1/4 of the group today, and my other co-chairs are Pamela Harris, Jennifer O'Brien, and Rebecca Cantor. And so the Early Childhood Professional Development Advisory is really tasked with the facilitation of the Colorado Workforce Early Childhood 2020 plan. And guess what? It's 2020. So when we were creating this, it just felt like it was so far away. And I know that there are some folks that were sitting at those spaces, and I was like, oh my goodness, that's right. So that means that, we're ready to keep going, and in the spirit of alignment, just wanted to bring your attention to the areas of opportunity that the Early Childhood Leadership Commission already has. And that second
priority area is elevating the early childhood workforce to ensure coordinated career pathways and compensation. Again, not a surprise to many of you here, and why this work will keep continuing. Okay, so for the Workforce 2020 plan, we have 6 overarching goals. We have 24 objectives, and we have 99 activities. So it's a small set of work that needs to be completed by the end of this year. However, I will say that we've done a lot of moving forward and a lot of accomplishments with the help of a lot of folks at the local level across the state and with some national support as well. And so because we have so many activities, we wanted the advisory group to think about zooming in a little bit more. So we actually did an exercise not too long ago, about August or so, that the variety of members who participate both remotely and in person, you know, we're averaging, oh my goodness, probably, it ebbs and flows, but anywhere from like 30 people to like 60 folks. Again, both remotely and in the room. So it's really exciting for us. So back in August, the advisory group filled out some surveys and saying like, what's really important to you and your community, and let's start zooming in a little bit more. And so out of that work and this iterative process, we actually distilled down to 4 priority areas, again, all part of the Workforce 2020 plan. Those 99 activities, 24 objectives, 6 goals. Boom, here we go. We're going to focus on the number 1 issue was workforce, objective 1, activity B, establish clear defined shared terminology for different roles and credentials that cross settings and sectors. The second one was retention and recruitment, explore relationships with early childhood councils to develop professional learning communities to share effective strategies around recruitment, retention, and improving educator efficacy. 3, compensation, again, exploring those relationships with councils. And 4, recruitment and retention, identifying barriers and convening roundtables to identify solutions to successfully recruit and retain people of color in leadership roles. So we're really excited to have this as a laser focus for the next few months for our advisory group. The other piece here is that, do you want to go to the next slide? Thank you. Oh, wait, that is the slide. Okay, thank you. So you also may have received a handout when you came in, opportunities for the future. So in this sort of iterative process of zooming in and choosing some priority areas, then it was, okay, who do we reach out to? Who are some partners? What's already existing? So this is an example of some of the ideas that were gathered so that we can really look at these objectives and say, okay, if we were to think about the workforce, establishing those shared terminologies, who do we need to reach out to? So some of the suggestions were to take a look at Head Start terminology, Power to the Profession from the National Association for the Education of Young Children, and then also partnering with our CDHS childcare licensing rules and regulations. So again, we should, when we're talking about workforce, what does that mean? When we have specific titles and rules, what does that mean? So again, just we want to be more consistent and have a better understanding across our system. Remember, we're also within mixed delivery systems. So thinking of our home visitors, our Head Start programs, our state-funded preschools, children receiving special education services. So again, you have this handout, and it's not all inclusive, but these are some of the pieces that the folks at the ECPD advisory had some ideas and suggestions. And so what does that mean for PQA? Well, we will be meeting the ECPD advisory February 4th from 1 to 3 at the Department of Human Services, 1575 Sherman. And we meet bi-monthly, and so it's the first Tuesday of the month. Our location is sometimes it changes, but it's mostly in the Denver metro area. and we meet from 1 to 3. It's open, we welcome, there's a remote participation, and I think with the momentum around the preschool development grants, again, as I was just sitting here, and then looking at the strategic plan with the paper icons that the PDG will have resources for, and those with raised hands, there's a few opportunities out there for folks who have interest in supporting the workforce, recruitment, retention, and compensation. In addition to that, I believe that there's some local magic that's happening. I know that there's some work happening in the Denver metro area. There's work happening in Summit County with the early milestones innovation grants that are happening. There's touch across the entire state, and so really thinking of the Early Childhood Professional Development Advisory Group as a way that we can come together and be more aligned and strategic as we think about these issues. So with that, questions, comments, concerns?
Are these different, as I look at this page, these were the notes from those, correct? And then what would be the sort of next steps with all of these? And, you mentioned there's 99 different activities. How will those be organized, and how will people be able to participate and support some of them?
Yeah, so it's really attending those, our meetings. So in our next February 4th meeting that we'll have, we're really going to zoom in on this, and then from the group's perspective, we have a few ideas, but also want to hear from the folks who go back to their communities and their agencies. So more to come.
Where is that meeting again?
The meeting is February 4th from 1 to 3 at 1575 Sherman, and that's the Department of Human Service building. And we can get you.
I can send out the information.
Great, thank you. Thank you. We also have a framework working group. Who's providing an update?
I am.
Thank
Sorry.
you, Amanda.
Really quickly. Really quickly, I just wanted to remind everyone, if you have not registered your program on the Early Childhood Framework Colorado website, please do. We are collecting, trying to create a comprehensive statewide organization just on this website. We've been sharing this website with policymakers, funders, legislators. We recently shared it at the Early Childhood School Readiness Legislative Committee, the interim committee. So if you have not, please do sign up, and I have the flyers on how to exactly go about doing that. We also have marketing materials, so we have those flyers, we have newsletter content that I can send out after the meeting, share with your network. This is our marketing materials. And then lastly, we are also on the website building a comprehensive, reliable, and robust research and reports section to share data on how Colorado is working to ensure all children are valued, healthy, and thriving. So we're looking for high-quality statewide data related to the framework. If you go on, submit for consideration is right where you want to submit your report, and our data subcommittee group actually reviews all of these to be put on the website. This is an old screenshot, so if you have submitted one, this is very old, and yours is on the website. And that's about it. So thank you so much.
Thank you. This is a time frame or time period for public comment or member updates. So I don't know if anyone has signed up for public comment. Thank you. Nope. Great, thanks, Stacy. This is also just an opportunity to hear any updates from members, if there's information for the good of the committee.
I'll just put in a plug for the DPP Preschool Showcase that is tomorrow morning from 9 a.m. to noon at the zoo. So if you know anyone looking for preschool, we'll have about 60 of our preschools represented. So families can just explore their options and then free admission into the zoo and explore all that. So, and a lot of our providers serve younger ages too. So even if they're a little younger than 4, still a good resource.
That's a great way to get, yeah. Good idea. Anybody else? For next steps, for agenda topics for future meetings, one of the things that we are anticipating for our March meeting is to talk a bit more about membership for the PQA. During the time frame for the preschool development grant, we had expanded the membership of this committee, which is fantastic. We know that a number of folks started to participate for the primary purpose of keeping updates and understanding what was happening with the preschool development grant, wanting to have input and so on. So at our next meeting, we'll spend a little bit of time kind of looking at and reestablishing our membership for the committee to determine, who would like to be considered, as an ongoing member of the committee. So we'll spend a little bit of time talking about that. We'll also talk a little bit about the direction and focus for the Program Quality and Alignment Committee going forward. As Lindsay noted, this committee does serve as an advisory for the preschool development grant, but there's more to this committee than serving as that advisory. So that has been a big focus of the committee for this past year, which has been completely appropriate and important. So we're just going to do a little bit of regrounding at our next meeting. So come prepared to provide your input on that process, and also be thinking about your role in this committee moving forward. We'll also be returning to our typical meeting schedule, which is every other month. For much of 2019, we had every other meeting devoted to the preschool development grant, and those have been primarily virtual meetings. So we're going to kind of return back to every other month meeting, and the preschool development advisory will be built into that time period. So just wanted to kind of preview that for you. The co-chairs will be kind of talking a little bit more and be prepping for that in advance of our March meeting. Are there any, Anna Jo, is there anything else that you wanted to make sure we talked about? Did I capture that well enough? Okay. We'll be glad to do it. Yeah, absolutely. If there's some things that you're thinking about and you want to, just let us know prior to that meeting, that's perfectly fine too. You can send some information to Amanda. Amanda, is there anything else that we needed to cover today?
I just want to mention that with us moving to back to the every other month schedule, we are going to keep the webinar option for those who want to join remotely.
I think that's been a great addition. Prior to the webinar option, we had always had a call-in option, but I think it's really nice to have the ability for folks to participate and see materials on their computers and not just hear the conversation. And I think, as much as we can meet here at the Health Foundation, we also have really good audio for those participating remotely as well. So, is there anything else for the good of the order today?
Do we have people on the phone today?
Yes, we do have a number. We had a large amount of people.
I wonder if they have.
Yeah, that's a good question. Thank you. Is there anything people participating online want to make sure gets put into today's conversation? Okay, well, great. Well, thank you, everyone, and we stand adjourned.